In this lecture, we will discuss the history and an overview of the US healthcare system. Learning objectives for this lecture include being able to differentiate between the different types of prevention, to describe various milestones associated with healthcare systems, and to be able to explain the concept of the iron triangle and how it applies to healthcare. When the practice of medicine first began, surgeons and barbers, those who cut hair, they practiced these two professions together in the same location. They even used the same types of instruments to do both functions, to cut hair and for surgery. And by 2017 in the United States, almost one-fifth of the gross domestic product, GDP, was being spent on healthcare, which is the highest in the world. So these are some images going back to the 1500s, the 1600s, early stages of medical development. They used to have this thing that's associated with barbershops even to this date, where their surgeons and barbers, they would either perform surgery, surgical procedures, and even cut hair, and sometimes even use the same tools to do these types of functions. By this time, they didn't really have the concept of germ theory or how diseases spread. So preventative methods, aseptic techniques, or even anesthesia was not really used during this time. US is the only major country that does not have a universal healthcare coverage or healthcare plan. And even as recently as 2002, there was no proper standard requirements for hospitals to even report certain outcomes when it came to patient. Only in 2002, the Joint Commission, which is an hospital accreditation organization, they mandate hospitals to tell patients if the results of their treatment outcomes were not standard, they needed to report that. So as you can see, the healthcare system or the practice of medicine and taking care of patients have come a long way, but even as very recently, there have been certain things that have been overlooked or not really done properly, and there are still challenges that are facing our system. So when it comes to healthcare and their goals, the main idea of healthcare is to be able to provide uh, certain health to address health needs of the consumer. And this is done in three different stages. We've discussed these in our public health previous course as well. We have primary prevention, secondary, and tertiary prevention. Primary prevention is the stage where we will try to reduce or remove the risk factors, factors that will be associated with illness. So for example, cessation of smoking, immunization, or even educating patients are some of these ways to reach this stage of prevention. Then we have secondary prevention, which focuses on early disease detection. If there's a certain disease, how can we address it at an early stage? For example, if individuals are starting to get high blood pressure, to have screening and maybe treatment of that so that advanced disease might not occur. Perform colonoscopies or mammographies to identify those respective cancers at early stages. Then you have tertiary prevention. This is the stage where a patient already has the disease. How can we reduce complications related to that disease? What are certain things that could be done even to help with rehabilitation of these individuals? So this would be, say, if a patient with a certain heart attack, a myocardial infection, how can you prevent the patient from progressing to have like heart failure or even death from it? That would be tertiary prevention. And then there is also a concept known as quaternary prevention. This is an extension of tertiary prevention where we will use the best medical information or even evidence-based medicine to try to see how we can optimize the care for these patient populations. So when it comes to healthcare provision, we have government entities and we have the private sector that plays a role. The government participates by putting certain regulations, and these regulations are done through several federal agencies. There could be even state agencies, and some examples are stated here. So these agencies will be specialized in certain areas, and they will put certain regulations that will help control and prevent the spread of diseases and even risk factors that will be associated with certain types of diseases. And also the government participates by uh, forming and making legislation. So these are sets of rules and regulations that are meant to help the consumers, help the public, and try to protect them so that everyone has to adhere to these legislation. And these will come in form of certain acts, and some of them are listed here, and they are very specific to certain populations and certain targeted groups. And then we have the private participation, which is going to be the healthcare cost or health insurance that are being provided. And that also plays a role when it comes to US healthcare systems, because that can dictate how medical treatment, healthcare is provided to individuals. So as we can see, there has been cost sharing methods through health insurance programs, how consumers have to share certain of the cost, and how it's shared among individuals so that the entire population can benefit from medical services. So again, in our public health principles and practice course, we've discussed the core functions of public health, which are assurance, assessment, and policy development. We also talked about the 10 essential services of public health and how these are being utilized to meet the health needs of communities and populations. We've discussed these in some detail, and even throughout this course, we will revisit some of these concepts and see how they related to the healthcare system. Now, recently, I think this was last year, they updated the 10 essential services of public health. They are still very similar, but they have been updated to reflect the current needs or the current goals that are there in the public health environment. So let's take the last 5 to 10 minutes to focus a little bit on certain milestones that are related to the US healthcare system. These can be categorized in milestones concerning medicine and medical education, hospitals and healthcare systems, public health, and also the US healthcare systems. For this lecture, we will focus on the first two topics, but I have provided certain handouts for students giving more detail about these milestones in all four of these categories. And I encourage students to read them, review them, to have a better idea of certain changes and certain milestones that have shaped the US healthcare system. So when it comes to medicine and medical education, back in the 1700s, uh, physicians were trained through apprenticeship program where a physician would teach another individual where there weren't any hospitals, so it was one-to-one teaching of students who would want to practice the art of medicine. The first medical school was established in 1765, which was the University of Pennsylvania. In the 1800s, medical training was provided through internships and existing physicians who were also poorly trained, meaning there was no standardization when it came to the practice of medicine. In 1847, the American Medical Association was established, and they started centralizing things. They focused on trying to standardize the medical education and see how physicians practice medicine. In the early 1900s, mainly medical profession was done by general practitioners or family practitioners who would go visit patients at their homes, and only a very small portion of them were females. In 1904, the American Medical Association also created a Council on Medical Education. This is almost like an accreditation organization that wanted to standardize the medical education that was provided through the medical schools. Then in 1930s, um, males were like the main predominant physicians, um, and the payment systems were mainly personal. So if you want medical services, you needed to pay for your own. But as we can see, when it gets to the 1940s, 1960s, a group health insurance started to form, and that helped offset some of these costs, both helping the medical community and also those in need of medical services. In the 1950s, the federal government started getting involved in these group insurance systems, starting to help support school operations, teaching hospital operations. By the 1960s, there were certain other programs that came into providing research grants and also trying to help develop the field of medicines through innovation and providing network among physicians. And even uh, as early as the early 2000s, say in 2008, we started to see that there was a increasing diversity when it comes to different races and ethnicities, even males and females, but still a larger number, a larger proportion is predominated by white individuals. And in 2011, the Affordable Care Act was established, and this also focused on trying to centralize all the different medical practices and promote innovation, new methods to be effectively deliver healthcare to patients. And in 2012, the Affordable Care Act also started providing incentive to physicians to try to hold them accountable in the practice of medicine and also to be more standardized in the care that they provided. And we'll go through a few milestones that are related to hospitals and healthcare systems. What we'll also see is there are so much overlap because US healthcare system is a combination of all different forms and practices of medicine and public health and how they all integrate and work together. In the early 1800s, there weren't any hospital systems. There were certain shelters that took care of the poor and the needy. And then when they started becoming sick, in addition to providing food and shelter, they also started providing treatment to the ill. In 1850s, certain hospital systems started developing, but they developed around physicians. They were owned by physicians, so they were also not very skilled providers, so there was no proper standardization. In the 1920s, as medical technology started advancing and developing, the quality of medical training and provision started to increase in the United States. And this helped establish certain hospital systems and make them the institution and make them the symbol of institutionalization for healthcare and healthcare provision. In 1930s and 1940s, the hospital systems that was once owned by physicians now started to be owned by certain organizations like church groups, certain facilities, and even at the government level. So, with time in 1970s, 1980s, there was the first patient bill of rights that was introduced to try to help protect healthcare consumers and to to be able to obtain the proper help that they wanted through standardization. Then in 1990s to the early 2000s, the federal government also started authorizing outpatient medicine and reimbursement through the government health insurance system. And as we mentioned previously, only in about 2002, the Joint Commission, that is a accreditation or a regulatory organization, issued that all hospitals need to inform patients if or not their results of the procedures or their treatments was what was typical or what was standard. So bringing in some accountability to say, yes, this is what is expected and this might be your situation. All right, so those are some ways that the medical system, even the hospital system, the healthcare systems developed and they morphed into what is it today. And we are still undergoing certain changes. As you can see, the US is uh, one of the developed countries that still doesn't have a centralized healthcare system, and things may or may not change depending upon the need of the society, communities, and even larger populations. So this brings us also to a concept known as the iron triangle. This is a triangle just showing a relationship between three different entities: cost of medical services, access to healthcare, and the quality of the medical services or the healthcare that is provided. So the balance of these three acts, how can we effectively provide quality medical services, provide access to the community, and try to minimize the cost in doing so. This triangle or these three balancing act is known as the iron triangle. And we talked about the Affordable Care Act even in our previous course. This was one of the central themes even in the Affordable Care Act, increasing accessibility, increasing quality, at the same time reducing the cost of healthcare provision. So in the iron triangle, if these three entities were 3 points, how can we balance them? How can we work towards effective delivery of healthcare without really causing any problems? That's the concept of the iron triangle. So, in this lecture, we looked at just an overview of how the US healthcare system has developed to its current state. We talked about how the US does not have universal health coverage. There are certain health disparities that still exist across the nation, and how about 1/5 of the gross GDP, domestic product, is being spent on healthcare, and it's one of the most expensive in the world. However, the system is improving for the better over the last 10 to 20 years. Many more individuals have had health insurance, thereby access to healthcare than they were previously. And healthcare costs are being either covered through the government agencies or through private insurance that will help individuals to have access to their healthcare needs. So this is what I have for today's lesson. If you have any questions, please feel free to email me, contact me, or post them on the discussion board.